Okay. Hello. Can you hear me?
Yes, we can hear you.
Yes, okay, sure. So, hello everybody. Thank you for coming in Tuberculosis Stigma Assessment Indonesia presentations. So, today presentation, we will have several speakers. So first we have like James Muller from Stop TB Global, following by speakers from Global Fund Principal recipients TB Community-Based Intervention Komunitas Penabul STPI. We have first the National Program Director, Henny Prabhaning Ahmad. The second, our research staff, Yuniar Ika Fajarati. The third is me, Permata, as a Knowledge Management Coordinator. And the fourth, we have Dwi Hari Subakti as the Monitoring, Evaluation, and Learning Manager from the Community-Based Intervention Consortium Komunitas Penabul STPI. And following the explanations about the TB stigma assessment, we also have the explanation regarding the experience TB stigma assessment in the field by the speaker from Indonesia TB Survivor Organization Associations, or we known as POP TB Indonesia, which is Paran Saramita Winarni, following with Albert Wirya from Indonesia Community Legal Aid Institute, who will present regarding the perspective of human rights of TB stigma assessment. And also, we also have presentation from Indonesia National Research and Development Agency, which is Ibu Christina Tobing, who present the importance of TB stigma assessment as the evidence for TB regulation in Indonesia. And the last speaker will be from the National TB Program, Ministry of Health Indonesia by Endang Lukitosari, will present the perspective of Ministry of Health and action plan for TB stigma assessment in Indonesia. So here my introductions about these presentations, and I hope we can discuss further regarding Indonesia TB stigma assessment after the presentations. Thank you.
Hello everyone, and welcome to this session looking at the TB stigma measurement assessment that's been conducted in Indonesia. I've just been asked to say a few words here to sort of set the scene and provide a global perspective. To start out, this has become an increasingly important area of work. Human rights related barriers to access have been identified as clearly inhibiting all efforts to find the missing people affected by TB. We need to be able to identify, mitigate, and overcome human rights related barriers if we're to find the missing people affected by TB and end the TB epidemic. The United Nations High Level Meeting on TB features a commitment where countries have committed to ending TB stigma. Also, 20 countries have conducted TB community rights and gender assessments that look at human rights related barriers. The most frequently cited human rights related barrier to the TB response that has been found across these 20 assessments has been that of TB related stigma. With that in mind, it's really critical to first measure TB stigma to understand how it manifests, where it manifests, and what can be done to overcome it. TB community-led monitoring has grown in prominence as well, and this has an increased focus of looking at issues of TB stigma, where it occurs, and how it manifests as well. But for the focus of the discussion today, there is a TB stigma assessment tool that StopTB has developed and released, and it has been utilized in several countries to really understand the experience of stigma and how it affects the TB response. The stigma measurement assessment contains sort of three indicators or three focus areas. The first is that of TB self-stigma, so the stigma that is felt by the individual with TB. TB stigma in communities, so the areas in which people live and work, in terms of people who have TB. And thirdly, the TB stigma that is experienced by people with TB in healthcare settings. Significantly, the indicators within this stigma assessment tool have also been included in the Global Fund Performance Framework. Therefore, they're a point of reference to understand progress or a key indicator in measuring success in terms of TB programs. In the most recently released Global Plan to End TB 2023 to 2030, there is also the emergence of a new target for TB programs and national TB responses, and that is to develop TB, CRG, and stigma action plans. That's in terms of all TB high burden countries, TB HIV high burden countries, and MDR TB countries. So this is certainly something that's of particular importance to a country like Indonesia, and it has been fascinating to see this process take place. And all the partners, many of which are speaking today, should be congratulated for their excellent work. I now hand over to the speakers to continue this discussion.
Hi everyone, my name is Heni Prabaningrum Ahmad. I'm the National Program Director of PR Consortium Komunitas Penabulu STPI. We are the Global Fund Principal Recipient for TB Community-Based Intervention in Indonesia. And I would like to present the background of TB Stigma Assessment in Indonesia conducted by our organization. Tuberculosis is one of the priorities issues in Indonesia as the third highest TB burden country in the world. This TB elimination is included in the 2020 to 2024 National Medium-Term Development Plan. And this emphasized by the Presidential Decree number 67 year 2021 as government commitment to end TB. One of the serious problems that hinder the TB elimination is the stigma. Stigmatization of people with TB often leads to discrimination, obstacle in accessing services, treatment delays, and discouragement to people taking TB treatment. The stigma on people with TB causes negative impacts on health efforts, such as TB prevention, service procedures, and policy related to TB elimination. Violation of health rights mean a violation of human rights. Therefore, this TB stigma assessment is very important in building knowledge and identifying evidence on stigma and discrimination issue on TB patient in Indonesia, and to provide a portrayal and how human rights issue contribute to stigmatization and discrimination against people with TB in Indonesia. We hope that this research would give and provide more information in achieving the United Nations high-level meeting on TB 10 key targets and 19 key commitments in 2022, particularly target related to access and availability of TB services in diagnosis, treatment, and prevention of TB for every citizen, and access and availability of equal human rights-based and citizen-oriented TB services. The objective of the TB stigma assessment is to assess the extent to which and how TB stigma acts as a barrier to both accessing and providing services. Therefore, support the development of recommendations to address TB stigma so that quality TB services are available, accessible, and acceptable to all. Special consideration are given to the needs of key vulnerable and undeserved population in Indonesia. I hope this background would give you all a clear information about the study. Thank you.
Everyone, I'm Yunia Rika, research staff at PR Consortium Penabulu Stop TB Partnership Indonesia. I will present method of TB stigma assessment in Indonesia. This research was funded by the Global Fund through PR and the Community Consortium Penabulu Stop TB Partnership Indonesia. This was a mixed method study using a triangulation convergent design based on the Stop TB Partnership Stigma Assessment tool. This study was designed with semi-structured data collection for quantitative analysis and FGD for quantitative and qualitative analysis. This study was conducted in 40 districts in 8 provinces in Indonesia that have a high TB burden but low notification. The semi-structured survey engaged 3,200 respondents, including people with or who had TB, or we can call it PWTB, the family who lives with PWTB, community or neighbor around PWTB, and healthcare workers. Also, 12K stakeholders participate in a focus group discussion in Jakarta, Indonesia to discuss policies, regulation, and media support at national and subnational levels. For the preparation, we are conducting secondary data through a literature review. Along with these activities, primary data collection was also carried out through semi-structured data collection and focus group discussion. The research report is made after getting the result of quantitative and qualitative analysis consolidation. According to TB National Information System or SETB from September 2020 until September 2021, we selected 8 provinces with the highest TB population by using Slovene formula, and then select respondents in every city by using cluster random sampling and considering the existence of a K population and human rights vulnerable population. PWTBK population consists of former prisoner, healthcare worker, indigenous person, minor, a person living with HIV, a person who uses drugs, person with disability, refugee, rural poor, and urban some resident. The mobile application TB Stigma is used to help with data collection and provide a Unicode for each respondent, and then monitor research progress and help export data to TB Stigma workbook in an Excel programs. Thank you.
Hello, my name is Permataimani Masilitonga. I'm a Knowledge Management Coordinator from PR Consortium Community Penabul STPI, or a Global Fund principal recipient of TB community-based intervention in Indonesia. And today, I would like to present to you the result of TB stigma assessment in Indonesia. So first, regarding about the stigma radar, based on the scale that we are measured, we found that the highest percentage came from the community or neighborhood, following from the healthcare workers, and self-stigma from the people with TB. Second, regarding about the TB stigma dimension, we found that there were 15% or 194 people with TB stated that they experienced stigma, and most of the locations came from the community or neighborhood, following from the hospital or clinics and workplace. And we also measure the stigma dimension in key population, and we found that people with TB in key population have higher percentage of the experienced stigma compared to the general population of people with TB. And in terms of gender or sex, we found that female have slightly higher percentage of experienced stigma, but male had slightly higher percentage of self-stigma scales compared to females. And we also measure regarding stigma in TB journey based on the cough to cure pathway, and we found that the most located stigma happen in the treatment adherence support and completing the treatment, following by the recognizing symptoms and beginning a treatment. These situations happen because sometimes there's still a misconception about the symptom of TB, and also a lot of struggles in terms of social and economic, and also like side effects of the TB treatment itself. And in terms of the law and policy environment in Indonesia, we found that actually we have strong regulation of TB, especially in 2021, we have the presidential decree, but this national level regulation is not yet translated in the district levels and also for the implementation guideline. Therefore, we still have the highest number, the harmful policy. And that's all for the results. Thank you.
Hello everyone, my name is Yaris Sakti. I am monitoring evaluation and learning manager at principal recipient consortium Penabulu SCPI. We are community principal recipient for elimination TB in Indonesia. I want to explain about TB stigma assessment, especially about recommendation. Indonesia TB Stigma Assessment shows that stigma among people with TB and their families. Although only a small percentage of people experience stigma, it can still have significant effect on the effectiveness of efforts to eliminate TB. The research found that people with TB are stigmatized. Internal stigma or self-stigma is a type of stigma experienced by many TB patients. Therefore, it's important to have comprehensive for TB stigma reduction in Indonesia. Based on this study, we suggest a TB stigma reduction framework. The framework is adapted from the Ottawa Charter for Health Promotion, and the recommendation consists of: the first is about advocacy. The stigma reduction law and policy on TB in all sectors and at all levels, including the identification, the adoption of health public policy in health sector. And the second is about supportive environment. The strategy is focused on having comprehensive guidance, infrastructure, and resources for stigma reduction and mass media communication. This should be addressed at all levels, including public policy, community, organizational, interpersonal, and individual. And the third is about empowerment. The intervention focus for enabling the key stakeholders to able the stigma reduction, for example, stigma and human rights sensitive training to health workers, cadre, or community. And the last is about partnership. The partnership focus on multi-sectoral approach. We need to implement strategies number 1, 2, and 3 from the government, from national, provincial, district, and sub-district level, NGO, grassroots level, and community. Thank you.
Everyone, my name is Salim Tawinarni. I'm from Indonesia, and before I bring my presentation today, I would like to say thank you to PR Community Consortium that already invited me as a speaker in this very important event at Community Connect. Since I cured from the RTB treatment in 2014, I joined as peer educator at the RTB patient organization in DKI Jakarta called Beta. And now I work as case manager in the RTB referral hospital. So during that time, I found there's a lot of stories that really connect and really close with the stigma in TB patient. And today I would like to bring few of the stories from the field to all of you. The first one came from 30 years old teenage who asked to sign the resignation letter after the human development research from her workplace find out that she had the RTB. The patient didn't get any support also from her family. She even got treated less pleasant by both of them. And the second one is came from 56 years old man, become deaf and currently has myopic eyes because of the side effect. Her two younger sisters rent a small place for the patient. The first younger sister only take the patient to the hospital for a regular checkup and then took the medicine from the primary healthcare center. And the other sister, it's only delivered for food for him every day. Only that, nothing else. And both of the sisters never have a really chat with the patient. So from that two stories, we know that TB stigma is still exists, and the patient is still have the experience with that. So I just want to tell you that there are so many things that can cause an impact for the patient. And back again from the stories, the impact for the patient, one of them is they prefer to hide their TB status from everyone. And they also lack of confidence because of the label that society has for them. They prefer to avoid people because of fear of transmitting the disease. And this is few things that also happened to me when I still have the treatment, the RTB treatment, is lost trust and hesitating to stop the treatment because one of the patients from the stories is work to support their own expenses, daily expenses, and almost the patient who have stigma is refused to access the TB services and feeling useless also. And the last one, who I also have this experience is I'm feeling alone and want to end up their lives. So what we can do to prevent all of these things? So we need an action. We need an action to minimize the TB stigma, and we can do a few things. We can do the raising awareness about TB more massive in society, like in workplace, schools, and community association. The activities can increase public understanding of of TB and also can reduce unpleasant treat for TB patient. We can also do the counseling session, not only for the patient, but also for the family, since they can understand what is TB patient has to face and how is the rules of the patient. Very, very important throughout TB patient, throughout the treatment journey. And we can also do the training for the TB communities to increase the knowledge more about TB stigma, what kind of TB stigma that always happen and always exists in TB patient. But it's not only for the TB communities, but we also have to increase awareness about stigma among the general population and health workers. And the last one, involve the community in the campaign and also the research for TB stigma. And this is something that I really like to say, that nothing about us without us. Thank you so much for listening.
Hi everyone, my name is Albert Wirya. I am the Research and Program Coordinator at Lembaga Bantuan Hukum Masyarakat or Community Legal Aid Institute. We are a human rights organization based in Jakarta, Indonesia, that provide free legal aid service for marginalized community. And I would like to share a little bit about the perspective of human rights of TB stigma assessment that was conducted in Indonesia. Before this study, there are several research projects that shown people with TB face human rights barriers in accessing their rights. One of which is our research in 2016 to 2017, indicating that there are at least 36 human rights violations. They are ranging from the right to health to the right to work, and they show that people with TB definitely face stigma and discrimination to access their basic needs. And therefore, the Indonesian TB stigma assessment is a monumental work. It proves that people with TB still face stigma on their daily basis, especially in the community, and it might hinder their access to health services and also influence them to drop out from TB medications. However, we must also note that the results shown in this assessment may only reflect the tip of iceberg of the human rights challenges that people with TB face in Indonesia. As mentioned by my other colleague, there are a lot of laws that have yet to be effectively enforced, especially those that provide legal protection for people with TB and key populations. Besides looking at the problem, we also saw that there are a lot of potential for human rights protection for people with TB in Indonesia. One of which is the successful story that community-based organization of people with TB have shown through their peer support or paralegal programs that support the people with TB to regain their right to work or their right to education. And we also saw the potential of there are many supportive laws that have been developed either both in at the national level and also at the local level. And we think that this trend of supportive laws should be increased, especially those that enlarge the protection against stigma and provide accessible legal remedies for victims of human rights violation. And lastly, I think we have to use the momentum of internet and social media to spreading the right information to achieve the right to information, because the main enemy of stigma is the right information, and for people with TB and also those who are affected by tuberculosis. Thank you very much for your attention.
I am Christina. I am a researcher from National Agency for Research and Innovation. I want to presentation TB stigma. The importance of the TB stigma assessment as evidence for TB regulation in Indonesia. Recommendation TB stigma reduction. The studies show that there is a stigma on people with TB in Indonesia. As mentioned, 35% of persons with TB experience stigma, and 6% of this stigma prevents them from seeking and accessing TB health services. This study could be based on further action for stigma reduction in Indonesia. There is already concern and collaboration with the Indonesian Ministry of Manpower regarding stigma reduction in the workplace. We hope that during intensive treatment for people with TBC, there will be 6 paid leave and no layoff due to their disease. This situation is actually based on the Presidential Decree number 67 in the year 2020. Article 12 mentioned that people with TB have the right protection from stigma and discrimination related to their disease, and Article 13 that government have obligation to provide TB services pet-friendly and patient-centered. Recommendation for further research related to TB stigma in Indonesia is 1. Research on the determinant factor of the TB stigma in the community, workplace, and health facilities. Research on the multi-stakeholder approach to stigma reduction action plan Indonesia. And 3. Research on Indonesia TB governance, policy and service, and knowledge of TBC in workplace. And the last, research on the integration of stigma reduction in the public health education, in society, and policy in people with TB service. Thank you.
Hello, I'm Endang from NTP Indonesia. I would like to share the perspective of the Ministry of Health of Indonesia and the action plan for the stigma elimination in Indonesia. The stigma experienced by TB patients often occurs in the community in various forms, such as being the subject of gossip, being ostracized, being expelled, and being prohibited from using public facilities. Meanwhile, TB patients or TB survivors and their families really need support and motivation from the people around them. The more widespread stigmatization will worsen their mental or psychosocial condition. The MOH of Indonesia seeks to eliminate stigma against TB by one of them encouraging government policies. Government commitment to eliminate TB in Indonesia and agree for TB stigma reduction plan in Indonesia as stated in presidential decree in year 2021 regarding TB elimination in Indonesia. In Article 12, it's underlined the policy that TB patients have right to get protection from stigma and discrimination related with their diseases. Furthermore, in Article 29, MOH of Indonesia also support and improve the community role and participation on prevention, stigma, and discrimination toward TB cases in society. Not only in presidential decree on TB stigma reduction also already incorporated in National TB Program 2020-2024. One of them is stated that stigma and discrimination reduction on TB high-risk population and key population will conducted through first TB awareness campaign, especially in school and workplace. Secondly, strengthen community and task force TB to create a supportive environment. Lastly, develop communication and counseling for stigma reduction guidelines for the STB and the RTB and TB-HIV. National TB Program, Ministry of Health Indonesia call upon community, private sector, and other stakeholders to collaborate together to eliminate TB stigma and end TB in Indonesia. Thank you.
Okay, so here the presentation regarding about the TB stigma assessment, and thank you for all the speakers. So we will move to the question and answer session. So all of the audience, if you have any questions, please put in the question box and please put your names and your questions. So first of all, we have one question from James Muller actually regarding about the explorations. I will read the question. We are talking a lot about the TB stigma. We know that this starts with language. Yesterday, the Word Matter session explored the issue with using terms of patients and case regarding about the stigma. Is this something that can be explored in Indonesia? So I will open the question for the speaker. Is any of the speakers would like to answer this question? Maybe.
If useful, Pamata, maybe I can add a little bit to the question.
Yes, sure, James.
So one of the things that clearly came across in each of the presentations was that when we're talking about stigma it can link to health facilities, but it also is much more beyond. It is not just about a doctor and a patient, and that people's lives, who have people living with TB, people who are being treated for TB, their lives are complex. And to address stigma, we need to have a bit more of a holistic view. So would it not be something that we can maybe begin exploring using terms like people with TB, or using rather people who are under treatment with TB, or people who have been diagnosed with TB? It is something that really humanizes the TB response. And by humanizing it, we go a long way towards addressing the issue of stigma for individuals in their communities, in their workplaces, and in healthcare settings. So I think it is something that's interesting to explore. Thank you.
Thank you, James, for the elaboration regarding about the question. So, yeah. So maybe Ibu Paran or Ibu Hani or Ibu Yunier or Pak Albert would like to answer that questions or give opinions about that?
Yes, can I say something a little bit? Yeah,
Yes.
thank you, James. I think that is right. We talk about this stigmatized people with the TB, right? So I think it is very important for us, for PR, for everybody's working in the TB sector, especially in Indonesia, to like what is it like we have the same language for TB patient, and maybe based on our research, can we like present something a little bit about the concept, Tata?
The slide, Ibu Hani?
Sorry?
Yeah. You would like
Yeah,
to
based on our research, we have this research result from this our research, right? So can we maybe elaborate a little bit about our approach on this stigma assessment, how we address this people with TB in our concept?
Yeah. So basically, like based on our research, like tuberculosis is quite also stigmatized language when using a patient in cases. In Bahasa or in the local language, patient is still using by the healthcare worker, and it's really common language that people use when refer to people with TB. However, when we call cases, it's quite difficult to translate it in Bahasa. It's often like there's a misinformation regarding about TB, not about patient and cases, but create a synonym of TB. For example, like they not mention they get TB, but they mention like our family get a lung disease. So actually, like the stigmatized language itself is the TB itself, not the case or not the patient. So that's what we found during the exploration of the research regarding about the language that's used for tuberculosis in the field.
Okay, thank you. Maybe we can add from Paran, from your experience, Paran.
Maybe I can add a little bit about it. Yeah, because you see the language for TB stigma, it's something new for our in community also, because when we trying to say change the patient into the people affected by TB, sometimes because so many years we always call that patient with the patient, so it's kind of like we have to get used to change the patient with the affected people affected by TB, and also for the organization, like so many years we used to use patient organization. And now we can try to change it with people affected by TB organization. You know, in Indonesia, I realized that language is something that if you used to use it for years, it is we need time to change it. It's yeah. Now recently we also already using patient change with the people affected by TB, but and I'm really apology if in my presentation I still put the patient on it. So yeah, I am agree with James also, because you know sometimes when we call someone with patient, it's not that convenience for the patient itself. It's more like maybe in Bahasa, I don't know, it's the English one is in Bahasa, when we call the ex-patient, now we call it more soft with the penyintas. I don't know what's they called with penyintas. It's another language for survivor TB.
Yeah, survive.
You know, yeah. So it's more because this is very new for our community in Indonesia. So I think we still learn how we can put this as something that common in one day. I think that's my add from me.
Thank you, Paran. I think we should put it like formally in our all of our documents, yeah, Parmata. Thank you,
Yeah.
James.
Yes, thank you for the questions, James, and thank you for the explanations also from Henny and also Paran. So I would like to move to another question. So we have two questions. First, regarding about the example of a stigma or negative stereotype that have been documented. Maybe like as Paran also already shared regarding about the story about the stigmatized and how the impact of the TB patients. But the question is, he also asked regarding, are these also a cure to other diseases and people who are poor? And I understand that stigma and discrimination is inseparable. Maybe like Albert also who can share about how stigma and also discrimination link to people with TB, and also like how the protections or how the right they actually can get from the legal protections regarding about that situation. Maybe like Karen or Albert would like to share something about that.
Yeah, maybe just a little bit, and maybe Paran could also expand on what I would like to explain. So regarding the question, the examples of stigma or negative stereotypes that we have documented, maybe one of the most pervasive stigma that we saw for people affected with TB is that the label contagious is one of the most hurtful stigma that people with TB could receive, because regardless of their treatment history, regardless of their treatment steps, they are all lumped together into a group that are contagious. So many people want to do not want to interact with them. They are being marginalized in the education sector or in the health sector or in their work. So I think that's one of the stigma that people with TB experience. And uh, also regarding uh, the link between people with TB and also their economic status, I think one of the major misconception that people in Indonesia have regarding tuberculosis is that tuberculosis could only infect people with impoverished condition, people living in poor condition. Uh, uh, they say that tuberculosis is not the disease for rich people, for example. So I think that's one of other misconception that we have to face. It is true that people in poor condition have their own barriers in accessing health services, but I think we also need to educate the public that tuberculosis could people could get infected by tuberculosis regardless of their economic status. So I think that's the link between tuberculosis and also economic factors. And regarding the question, do this also occur to other diseases? Yes, I think in Indonesia, the negative stereotypes, the stigma are also experienced by people with different health condition. For example, people with HIV. Earlier in the pandemic, we also saw that there is a high rise of stigma and discrimination to people with COVID, for example. So I think there are specificity of a stigma for people with certain health condition, and maybe continuing from what Parmata have already asked, maybe uh, one of the ways to combat these negative stereotypes is to create a much more reliable information that is free from bias and also from uh, the lens of morality or from the lens of religion, and seeing the people living with TB or people with other diseases are only people like the rest of us. Maybe that's a little bit explanation, and others could also join in.
Thank you, Albert, for sharing regarding about that. And also maybe like Paran would add something.
Yeah. Also agree with Albert about another disease that we have the stigma. It's one of the new one. It's COVID. It's also the same. Everyone have very stigmatized with people with COVID. So you know, in here, TB is related with the poor people. TB is also related with the very not good in when you do your life, and something and another thing like that, very close to patient TB that's really labeling, and then it come up with stigma. And recently I joined with the paralegal community for TB. So I have one case that one of a work, she was work in a laboratory factory, and then you know what? Because she have TB, the human resource development say that you cannot continue your job, your work in here. So now she's employed. She's not working again, unemployed. So for me, it's stigma and discrimination. It cannot be step aside from from people with TB. And with this research about TB stigma assessment in Indonesia, it's clearly that we still have stigma and discrimination in Indonesia. Is it also from the hospital or community, on the neighbor, family also, and then workplace, school, and company? So we still have to face, people with TB in Indonesia still have to face and dealing with all the stigma that come from these areas. And what I know is why people really like to give stigmatize and discrimination with to people with TB, because they don't know much about TB. They didn't know exactly what is TB, because you know what? TB is curable and preventable. But that's something that people didn't realize it and didn't want to know much better about it. So it become a stigmatized and discrimination. So I think like we have to hand in hand to make the rising. Maybe it's kind of like to old step raising awareness, but this is the fact. People with TB, it's always be stigmatized and discrimination with other people in every areas. So with the rising awareness with TB with right, I think this is one of we can do or reduce, or maybe we can make the TB people with TB cannot have any stigma or any discrimination from other people. I think that, yeah, it's from me now.
Okay, thank you. It's a wonderful answer from Albert and also Farah regarding about stigma in Indonesia and how we move forward regarding about stigma. And in the chat, James already mentioned that currently Indonesia working to develop the CRG action plan and also like stigma reduction plan with all the stakeholders in Indonesia. And we hope that at the end of this year or early next year, we also have the concrete actions to reduce the stigma and move forward to ensure that TB actually being focused and also eliminate TB in Indonesia. So that's all from today's presentations. And I think because of the time limitation, we need to close the session. And I'm really thank you for all the participants who already coming to this presentation. And thank you for the Union Conference who make us able to have discussion about the TB stigma assessment in Indonesia. And I'm apologize for any technical difficulties or errors or any something that's not comfortable in this meeting. So I hope we will have a further discussion regarding about the stigma of tuberculosis, and let's work together to end TB in Indonesia and also in the world. Thank you all.
Thank you all.
Bye.